Stroke has no age limit and can occur at any given moment. It can be a frightening situation when it happens to you or a loved one. Fortunately, St. Luke's offers leading-edge stroke care that we can count on. Today we'll be learning more about prevention and interventional care. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at excellence in stroke care offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist tonight is Dr. Daniel Ackerman, a neurologist who's the interim chief of the Department of Neurology and serves as the director of stroke and vascular neurology for St. Luke's University Health Network. As an advocate for stroke prevention, Dr. Ackerman is passionate about helping people who have experienced stroke, as well as other illnesses of the brain and central nervous system. Dr. Ackerman, thanks for being here.
Ashley, thank you so much for having me.
Dr. Ackerman, can you tell me about your decision to become a neurologist and why you're so passionate about stroke care in particular?
Absolutely. It actually probably started with my mom. She didn't have a stroke. She is actually an emergency room nurse, and I spent my childhood working with her and watching her help people, and particularly during the scariest moments, she was always the first one to try and jump in and provide a helping hand and do whatever needed to be done. So for me, that was just inspiring. And neurologic disease is really scary, kind of like you mentioned. It's when all of a sudden the brain or the body isn't working the way we expect it to, it can really change us. But once you demystify that, once you can help people understand what's going on and why it's happening and what to expect, you can make a huge difference. And with stroke in particular, you know, every minute counts with stroke, and the more quickly we can get to it, the more we can help patients.
And when you were studying medicine and you had to decide on a field, why neurology?
Neurology fascinated me for a couple of reasons. The ability to do an examination with someone and work with them and understand what's going on under the hood, what's happening in the brain, in the nervous system, and where it's happening. It's really a special art in medicine. It still relies so much on our connecting with patients and talking to them and listening to them and observing the way they move, the way they act. It's just a wonderful way to be able to work with people.
And we've come such a long way, but there's still so much we don't know about the brain, so I would imagine that's pretty interesting as well.
Oh, the research is incredibly fascinating, and it's moving so quickly it's hard to keep up with, but it's a great problem to have.
Excellent. Thank you so much for being here. Joining our panel next is Dr. Martin Oselkin, an interventional neuroradiologist focused on the treatment of patients with vascular disorders of the brain and spine, such as stroke, aneurysms, and vascular malformations, using minimally invasive interventional techniques. Dr. Oselkin, thank you for being here.
Thank you for inviting me today.
First, let's start with explaining what is an interventional neuroradiologist. That's a lot of big words. What is that?
Certainly a mouthful. So very simply, what I do is I use very advanced imaging techniques to guide very, very small wires and plastic tubes that we call catheters. And through those wires and tubes, we navigate through a patient's blood vessels, either through their wrist or through their groin. And we go all the way up into their brain, and then we repair problems with the brain vessels from the inside. And we use special devices and all sorts of techniques and tricks that we have up our sleeves.
It seems pretty incredible to be able to take such a tiny little wire through a wrist and go up into a brain. How did you become interested in this field when you were studying medicine at first?
So I wanted to get into a field of neuroscience before I even went to medical school. I was always interested. The brain is one of the least understood organs of the human body, yet it is one of the most fascinating to me. So I thought that was really exciting. And then in my first year of medical school, I was introduced to the field of interventional neuroradiology. And at that time, it was brand new. And the opportunity to be part of something cutting edge, innovative, that had such a positive impact on patients' lives seemed like an opportunity I could not say no to.
It must be incredibly rewarding and fascinating to see how far the field has come and continues to go.
Absolutely. It's changing day by day. The way we used to practice it 10 years ago is not necessarily practiced the way we do it now. In the next 5 years, there will be even more technological innovations.
Thank you both for sharing your expertise. We'll be right back after a short break, but before we do that, let's check in with Dr. Daryl Gaines out in the field as he discusses stroke prevention and healthy habits that can help lower stroke risk.
Hi, my name is Daryl Gaines. I'm a physician here at St. Luke's in internal medicine. As a physician in internal medicine, I see patients in the outpatient setting in clinic, and I manage a lot of chronic conditions from diabetes to high blood pressure. To help my patients, first and foremost, we look to see if there's anything that we can do from a dietary and lifestyle standpoint. From a lifestyle perspective, I always talk to patients about, trying to do some type of moderate physical activity, such as going for a brisk walk for at least, 150 minutes per week, or doing some type of more strenuous exercise for at least 75 minutes a week. Some of the biggest things from a dietary perspective would be trying to limit your intake of saturated fat, trans fats, and processed foods in general to help lower stroke risk. If we're unable to get the goals or what we're looking to achieve from that standpoint, a lot of times we may turn to things like medications to help further improve diabetes or cholesterol numbers. Age and family history, so those type of things would be considered more non-modifiable risk factors. So definitely as you get older, there's more of a risk of stroke. If you have a strong family history of vascular disease, that's something to also keep in mind. There's a close tie between blood pressure and stroke. If you have uncontrolled blood pressure or your numbers are elevated, your risk of stroke goes up as well. So if someone has diabetes, the blood sugars are not optimally managed, you're at risk for developing these plaques that can narrow blood vessels and potentially lead to things like stroke and heart attack. There are two things that cigarette smoking does to the body to elevate stroke risk. So cigarette smoking in itself can make you more likely to develop a small clot within the blood vessel. And then more so from a long-term perspective, smoking in general kind of speeds up that process of you just building more plaque in the arteries in general. One of the main medications that we use are statin medications, which most people have probably heard about from a blood sugar standpoint. We have oral medications, injectable medications to get better control of things. My advice for helping to prevent stroke, really focusing in on a lot of the modifiable risk factors, and a lot of it really does come down to lifestyle. So, making sure that you're staying, physically active, watching your diet. In terms of the care that St. Luke's can provide for people that just have more questions about, what they can do to reduce their stroke risk, or where they should go if they've already had a stroke or if they have a family member that's had a stroke. We have excellent neurologists who are well trained in stroke care for those people who have unfortunately had strokes. And in general, the first place that you want to start to see what you can do to prevent stroke is with your family doctor.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
St. Luke's Pediatrics delivers everything from checkups to specialized care, all conveniently located close to home, so kids will have happy, healthy childhoods. St. Luke's Pediatrics, caring for your future.
Welcome back to St. Luke's Health Now. Tonight we're discussing excellence in stroke care offered at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting personal questions that we'll answer later in the show. Joining me are Dr. Daniel Ackerman and Dr. Martin O'Selkin. Let's dive deeper into stroke care offered at St. Luke's. But before we do that, I would like to ask you, Dr. Ackerman, how do you know if someone is having a stroke? What are the warning signs? What do we need to look for?
Well, thank you so much for that. That's actually one of the most challenging questions for patients and for physicians sometimes to answer. One of the interesting things about stroke is it often has no early warning. In other words, people long beforehand are not usually feeling poorly. They may not show any signs of being sick. The symptoms of a stroke tend to begin instantly, and they tend to be quite painless, which surprises most people. They say, gosh, it didn't hurt, and it usually doesn't. The symptoms to look for, we use a mnemonic to help us remember them, and that mnemonic is be fast. So the B stands for balance, so if you suddenly lose balance or coordination. The E is eyes, if you have a sudden painless loss of vision or double vision. The F is face, is your face drooping on one side or not even? The A is arm, which really could be arm or leg. Are you weak on one side of the body? And the S is speech. Is your speech garbled or slurred? Or are you having trouble forming words? If you see any of those signs, the T is time, as in it's time to call 911. Because with a stroke, early damage may be happening, and the sooner we get to a patient, the more of that damage we can prevent from becoming permanent.
And it's interesting that you mentioned these warning signs, be fast, because I actually had a friend who was having trouble finding words. She was not having trouble speaking per se, but was having trouble finding words, and that went on for about a day until someone said, you need to go, and she was actually having a stroke. So I think that there's those subtleties, anything that's off needs to be checked out. Well, Dr. Oselkin, I want to ask you about the different types of strokes, because as I just shared about my friend, there are very different types of strokes, and how are they different?
There are two main types of strokes, what we call an ischemic stroke, and another type is called a hemorrhagic stroke. An ischemic stroke is the most common type of stroke, which occurs when a blood clot gets stuck in one of the brain vessels, and that prevents blood flow, so oxygen and nutrients can't get to the part of the brain that was supplied by that blood vessel, and that part of the brain starts dying, unfortunately. That can cause symptoms which really depend on the location of the brain, because the brain has different parts responsible for different functions. A hemorrhagic stroke is when there is bleeding in the brain. So that is most commonly caused from high blood pressure. However, it is also commonly caused by an aneurysm. An aneurysm is a weakness in the wall of a vessel, which then stretches out like a balloon, and then it may rupture. Also, there are other problems with vessels. When you have bleeding in the brain, it can be catastrophic.
Absolutely. And you know, Dr. Ackerman, Dr. Oselkin just mentioned the idea that high blood pressure could cause a certain type of stroke. What brings on a stroke, and what are the other factors that people might need to consider that puts them at higher risk?
Well, some stroke risk factors are relatively classic, the same kinds of things that we've been talking about for a long time that can impact the blood vessels in the heart, can impact the blood vessels in the brain. So the most common ones include high blood pressure, high cholesterol, diabetes, obesity, smoking. But there are some that are maybe a little bit less well known. For example, sleep apnea can be a risk factor for stroke, and one that's commonly not as well recognized.
It's interesting because you think of sleep apnea, and I know a lot of people are fearful of getting tested because they think they have to go somewhere for a night or they have to wear a giant machine, but I understand a lot of that is changing. It's a lot simpler to get tested. Is that correct?
Oh, absolutely. So we now do a lot of home sleep studies, which are very simple and easy to set up and much more convenient for patients. In addition to the sleep apnea masks and devices that we use now, there are really a lot of different ways those masks can be configured, and there's even a surgical device that can be used in place of a mask if someone really can't tolerate it. Sleep apnea is so common that thankfully the technology is really starting to pick up, and as we get better at recognizing it, we're getting better at treating it.
People shouldn't be too fearful to get checked out in that case.
Not at all.
Dr. Oselkin, when someone finds themselves in the hospital and they've had a stroke, what is the role of interventional neuroradiology in the treatment of a stroke? And do you treat both types of strokes that you mentioned?
I'm going to answer your first question there, and my role is, really immediately. The old adage in our field is time is brain, because millions of brain cells are dying each minute once a clot forms in that blood vessel. So the earlier we can get to the patient and the earlier we can get that clot out, the better their outcomes are.
Wow, excellent and really fascinating. And I know that St. Luke's is an excellent center of excellence for stroke care. Tell us a little bit about what patients can expect, Dr. Ackerman, on the way to recovery.
So, on the way to recovery from stroke, one of the most important things to recognize is that recovery begins the minute the stroke happens. And so from the first time someone gets into one of the St. Luke's facilities, and I should mention, every single one of our St. Luke's hospitals is a certified primary stroke center, with the exception of our Fountain Hill, our university campus, which is a comprehensive stroke center. It means we have some additional capabilities there. But every hospital that someone goes to, in addition to treating the acute stroke as it's happening, we immediately start with stroke rehabilitation and medication to help prevent additional stroke. One of the things that patients can expect is that as part of their evaluation for stroke, we'll investigate why we think the stroke happened and usually recommend either medications or procedures or both to help lower their risk for having a stroke in the future. With regard to the symptoms that come with a stroke, often we notice some improvement over the first couple of weeks, but then very slow, steady improvement over the course of several months. That's why St. Luke's has several neuro rehab centers throughout the region that are specialized with regard to physical, occupational, and speech therapy, really focused on treating neurologic problems and really able to offer leading edge rehabilitation and recovery exercises.
Important for people to know that they can recover to different degrees, and St. Luke's will be there for them throughout the process.
Absolutely. It's a whole continuum.
Dr. Oselkin, you mentioned some of the techniques and treatments that you're using. What are some of the newest innovations that people can look for when they get stroke care at St. Luke's?
So the technology for our procedures is always changing and there are innovations, but also one of the biggest innovations in our field is probably with artificial intelligence. Diagnosing a patient, finding out who is having a stroke earlier is probably one of the best things, for someone's prognosis. We're using artificial intelligence to tell us who's having a stroke before we even know it. We're using artificial intelligence to tell us who would benefit from procedures such as a thrombectomy. That's one of the procedures that we do to remove a clot from someone's brain. But it's constantly evolving field, and that's one of the exciting things for me. And outcomes are just getting better and better for all patients.
Really incredible and such a positive use of AI. You mentioned speed, and Dr. Ackerman, you mentioned as well. How important is the relationship that St. Luke's has with the EMTs, EMS services in the area, and does that have a positive impact on patients?
Oh, absolutely. It is incredibly crucial. So we actually get to work with our pre-hospital colleagues, our EMS and paramedics, in a couple of different ways. We help to organize their stroke education, so the same things that we're talking about, we're teaching our EMTs and paramedics so they can recognize when a patient is having a stroke. Sometimes a patient may not even realize it after all. In addition to that, we're actually working with them to deploy a way for us, not through AI, but through an iPad system to actually get directly into the ambulance and start examining and working with that patient before they even get to the hospital.
Wow, okay, so you're saying that they are on the way and they're able to communicate with you and your team to get the care that the patient needs while they're still in the ambulance?
Absolutely.
That's really incredible.
One of the big opportunities that we've taken at St. Luke's is with our pre-hospital stroke program. So right now, paramedics will call us in advance and tell us they're bringing a stroke patient in. That gets everything rolling. We immediately activate what we call a stroke alert and get everything moving to start taking care of that patient the second they hit the door. That's one of the reasons it's so important that patients call 911 if they think they're having a stroke, even if they're reasonably close to the hospital. The early warning that we get leads to much faster treatment. And now, being able to see patients directly in the ambulance before they get to the hospital is one more way that we're going to accelerate what we do.
Incredibly important to call 911 rather than drive yourself, and this is an example why. Dr. Oselkin, how do you work together with an interdisciplinary team to provide the best care possible? Because it takes a lot of people to help someone recover and be treated for a stroke.
It takes a group effort. There's no one person who does it all. And that coordination of care, it starts before the patient arrives. When we heard about the pre-hospital notification with EMS, and notifying the ER doctors, notifying the neurologist, the interventional neuroradiologist on call. And then we go for a procedure or appropriate treatment. Once a patient is in the hospital, okay, there are other care teams. We're trying to find out what is the cause of the stroke and how to prevent it. And the journey for the stroke patient doesn't stop there. Then we start the rehab process. The rehab process starts as an inpatient while we're doing all of our other testing. And there's so many different teams involved, therapists, and it's all guided by a team effort with expert specialized training.
It's amazing how comprehensive and how great the communication is with the entire team at St. Luke's. Thank you so much for sharing all of your knowledge with our community. Speaking of, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
I'm Don Plow, and I'm the general manager of the Kalahari Mount Poconos Resort, and I'm also a stroke survivor. In the back of your neck, you have these two really small arteries called the vertebral arteries. That's the plate where the stroke started, and I stroked out somewhere between 40 and 60% of the left hemisphere of my cerebellum. That is all the command and control part of your brain. Throughout the course of the day, I just continued to feel worse and worse and worse. Finally did start a pretty intense vomiting regimen. I was so sick, I couldn't even get out of bed. I called my wife. I said, "Can you please come get me and take me to the doctor?" I knew something was wrong. I had no idea what the issue was. There was a group of neurologists that were meeting with me, and then there was the neurosurgical interventionist, which is Dr. Sulkin. And he did a same angioplasty procedure, and he put this stent in my right vertebral artery that opened it up to the full level that a normal person would have. I am a St. Luke's guy. I refer everybody to St. Luke's. The care all the way down through the entire St. Luke's organization was just fantastic. And they got me up out of bed within a couple of days. I worked so hard with my recovery, whether it was physical or mental, to get my life back. And he was an amazing physical therapist. He was very patient at first, but he was the one that really got me started on being able to attack the physical side of my recovery. Stroke recovery is something that you can achieve. You can have your life back. It takes a lot of hard work, a lot of dedication. If you work hard, you can have a good recovery.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had an engaging conversation about stroke care at St. Luke's University Health Network. Thank you to our amazing panelists. All right, now it's time to get some questions from our audience. You guys ready?
Absolutely.
All right, first question, Dr. O'Selkin, is for you. How is a stroke assessed when it comes to determining the best course of action for treatment? Is it ever too late for an intervention to be beneficial? Good question.
Excellent question. And the sooner, the better. As we said, time is brain. However, one of the innovations in this field that we talked about is that we can now treat patients much later. And we use artificial intelligence to determine if someone would still benefit when what we call outside of the normal window. About 10 years ago, that was 6 hours from the onset of your symptoms. After that, you would not be eligible for treatment. But now we can go all the way up to 24 hours. And in the future, it may be even later.
This is not an excuse to not come in if you're having symptoms.
Absolutely not. Your prognosis will be, your outcome will be much better the sooner you come in, but we don't want to turn someone away if they might benefit from treatment.
Excellent. All right, Dr. Ackerman, I believe this is for you. My father is 65 and he's recovering from an ischemic stroke. What is the likelihood he will have another episode in his lifetime, and is there any way to reduce the risk? This is a great question because I think anytime anything happens with your health, you wonder, will it happen again?
Absolutely. Well, from the time that someone has a stroke, we know that that patient or that individual is going to be a little bit more likely than your average person to have another one. There's not a great way to quantify that in percentages. I can't say it's a 15% chance versus a 5% chance. However, for any patient presenting at St. Luke's, one of the big investigations is to look for the stroke cause, or what we call etiology, and that guides our stroke prevention strategy. So with a combination of medicines and lifestyle changes, we can significantly drive down the risk for stroke. It's not that uncommon that people will come in with a stroke and they didn't know what their risk factors were at all. It was through that investigation we figure out those risk factors and get them under good control. So continuing to work with the neurology group and with the primary care team is absolutely crucial in lowering that risk, but it can be done.
Dr. O'Selkin, this is for you. How far have we come with stroke care over the past 20 years, and do you see even better, less invasive treatments and therapies on the horizon? Pretty non-invasive now, but could it be even less invasive in the future?
So where we've come from 20 years ago to where we are right now is incredibly exciting. And there is a bright future on our horizon. 20 years ago, we were not doing any sort of thrombectomies, which is the procedure we talked about where we removed a blood clot. 6 years ago, we were only treating up until 6 hours. Now we're treating up until 24 hours. It's going to advance to probably 36 hours in the next few years. We're going to be utilizing robotics and artificial intelligence more. That is just the way of the future, and it's going to improve everyone's lives for the better.
It's really excellent. Unbelievable how medicine is advancing. All right, Dr. Ackerman, for you, what makes recovering from a stroke so challenging? That's just a great question because we hear that it's challenging, but what makes it challenging?
So I think there's a couple of important points. First of all, stroke recovery is a slow process. Even though stroke happens like a bolt of lightning, it's incredibly quick to start, but recovery in the brain takes sometimes years. And because of the changes that happen with a stroke, patients are accustomed to being able to just work hard, and the harder you work, the faster it goes. Unfortunately, that just doesn't work with the brain. The brain is too delicate, and it's going to recover at its own pace. The other thing that can be really challenging with stroke is the big change in our lives and lifestyle that happens. When a stroke happens, it can impact our abilities to speak or think or drive or walk, all the different things that we do independently, automatically every day. And so that can create a big difference in the way someone lives or works or what they're doing. Because stroke can happen even in very young patients. I mean, 10% of all strokes happen in people under age 50. And recently in the network, we saw someone as young as 13 years old experiencing a stroke. So if you think about how busy people are and all the different things they have to do, stroke is going to have a big impact in every aspect of their lives.
Dr. Oselkin, what puts someone at risk for a stroke, and what can they do to lower their risk of stroke?
Sometimes we don't know what causes a stroke, but there are certain things we can modify in our lives to help reduce those risks, such as having an active lifestyle, regular exercise, reducing your cholesterol, managing your weight and diabetes, if those are medical conditions for you.
We talked about be fast and the importance of time when it comes to a stroke, but what about people who might have risk factors? What do you want them to know? Because they can't spend their lives worrying, but at the same time they need to be vigilant so they prevent a stroke.
Absolutely. Well, I think first of all it's important to recognize that because stroke is very common, there's a lot of great information that your doctor and other healthcare professionals can use to help really drop that risk and drive it down. And because of that, because we can anticipate that in some patients, working with them to control the risk factors that we've been talking about will really go a long way for stroke prevention. The other important thing I would want to mention is that if you think someone is experiencing a stroke, in addition to calling 911, it's very important to not do other things. For example, if someone is having a heart attack, we often talk about having them chew some aspirin or take some medicine. You don't want to do that with a stroke because the symptoms of a bleeding stroke and a clotting stroke can be absolutely identical. And so it's very important that we get the patient to the hospital so that we can differentiate between those two and treat them the right way off the bat. That's something a lot of people in the community I've found they try and do, giving people some medicine or have them drink some water or have a snack or take a nap. With stroke, you want to overreact. And so if you're suspicious of a stroke, the first call is 911. After that, call whoever you want.
Thank you both for such great and informative information. We want to remind people, be fast and call 911. And for more information on stroke care and the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. Thanks for tuning into this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.